been really a great pleasure for me to work with Catherine Otto in the valvular heart disease companion to Brown-Well's heart disease. Catherine is one of the premier experts in many things, including imaging of the heart, echocardiography, and also in valvular heart disease, prolific author, and so it's just been great to work with you, Catherine. She has done this book several times, and in the third edition of her book, we brought this into the Brown-Well family. And I was thrilled to have the opportunity to co-edit the third edition with her that we published several years ago. And now we're doing the fourth edition of Valvular Heart Disease,
right.
Otto and Bonow, and Brown-Well's companion series.
Yeah, and I think, but coming into the companion series has been great. And then I think what's really been exciting is that there's so many people interested in valvular heart disease now. Really, we've been able to recruit really excellent authors from around the world with expertise in each of the different areas. So I think it's really brought a lot of depth to the book to have that kind of expertise, and then the crosstalk that we get between the authors is, I think, really enhanced what we can offer in that book now.
And in many other areas of the companion series, we find that it's very easy to attract and entice the best authors, the most visible people in the field. And I think having Dr. Otto on the masthead also is a major plus in attracting all of our friends to write good chapters for us.
I think that's just been the past 5 years. There's just been tremendous advances in valvular heart disease, really from the basic science level. So we're really going to try to expand a little bit upon the basic science with more chapters focusing on that, on the epidemiologic risk factors that are associated with valve disease, and then certainly on the therapy side. Maybe you'd like to comment on that.
Well, yeah, there's been so many other advances in terms of percutaneous and transcatheter devices that are extremely hot, and keeping abreast of all the changes in transcatheter valve technology, both for the aortic valve and mitral valve, is extremely important to maintain a feel of current practice as is evolving so significantly. Not to mention the fact that the cardiology and cardiac surgery community has been publishing lots of new data regarding outcomes of patients before surgery, without surgery, and also patients after surgery as well. So there have been major advances, at least in our knowledge base, in terms of the outcomes of patients, indications for surgery, and in some cases the type of surgery that should be performed. So keeping our readership up to date with all of these new advances is quite important. And as Dr. Otto said, we're seeing a huge interest now, generated in many cases because of the transcatheter technology, but now I think a growing interest and thirst for knowledge in the fundamentals of valvular heart disease, and so providing the basic science components of the pathophysiology is also very, very important now.
Well, I think that, just kind of building on that, I think the thing is that valvular heart disease is now a field that's really bringing together a lot of different specialties. So we've got basic scientists, epidemiologists on one end, but we have cardiac surgeons, interventional cardiologists, imaging specialists, and sort of valve experts. So it's become an integrative kind of practice, and that's actually being reflected in people's practice. Medical centers are developing valve centers with that integrated expertise going across the traditional specialties. So I think this book really provides the backbone for that kind of valve clinic, that you could use this as your basis for your information in treating those patients.
Yeah, the Center of Excellence in Valve Disease is being created in many places, and I think our book really provides all of the fundamentals and all of the high-end things as well as fundamentals that all of the components of the heart team will benefit from.
Yeah, so it really reflects how we're providing care now for valvular heart patients.